Kia ora koutou katoa. Welcome to this afternoon's update. I'm sorry about the small room. We're sort of back where we started here a few months ago. Now, there are 2 new cases of COVID-19 to report from managed isolation facilities in New Zealand today. First case is a man in his 20s who arrived in New Zealand on 19 June. He flew in from India on Air India 316. He has been staying in managed isolation at the Pullman Hotel, and now, as is our protocol, being moved to the quarantine, which is the Jet Park Hotel. The second case is a man also in his 20s who arrived in New Zealand on the 18th of June from the US of A. He was on flight NZ5 from Los Angeles. Man tested positive at the Jet Park Hotel after showing respiratory symptoms. Now, he had been at the Jet Park Hotel from his arrival. I understand there was a mix-up at the airport and he got in the wrong group, so he ended up going to the Jet Park. So he's actually been at the Jet Park since arriving, became symptomatic and was tested as a result. So actually both of these cases were picked up at our now routine testing at around day 3. In the second case, as you'll note, the man was also symptomatic. I can also say that one of the cases who has been in isolation in the Wellington region, in the Hutt Valley, is now considered recovered, and recovered being at least 10 days since onset of symptoms, at least 48 hours asymptomatic, and a negative test. So the total number of active cases in New Zealand is 10. Our total number of confirmed cases now is 1,165, and we still have the one significant cluster open. This is the one in Auckland at St Margaret's, but obviously no cases as a result of that cluster for some weeks now. Yesterday there were 4,303 tests processed at our laboratories around the country, and our total completed to date is 348,822. Just some comments on our testing as part of our border measures. So since June the 9th, we have rolled out the testing in managed isolation facilities at around day 3 and around day 12 of people's stay. There's been some suggestions in recent days that we should be testing people on arrival at the border, possibly as a third test. What we do at the border when people arrive, everybody arrives, is a health screen, a series of careful questions that they respond to. And anyone symptomatic at that point goes straight to the Jet Park facility and is managed as a symptomatic person and tested as part of that management. Anyone who is not reporting symptoms goes to one of the other managed isolation facilities. The reason we don't test on arrival and we wait till day 3 of the managed isolation is because that is about day 5 of many people's journey from wherever they have come from into New Zealand. And we know that testing then is more likely to pick up infection than earlier testing when people may be incubating the virus but not test positive. So that's the reason for the testing around day 3 instead of at the border. And likewise, the testing at day 12 provides extra security. First of all, because the tests do have a false negative rate of somewhere around 20 to 30%, but also it's part of our departure planning for people to make sure they do have, we can confirm that they don't have the virus. Now, I've talked before about the fact that these people who get positive tests quite late in the illness, there have been studies done in both Singapore and South Korea of these people who get a positive test. So the virus is detectable, but it's seems very clear from those 2 studies that they're not actually infectious. The testing, though, if it is positive at day 12, means that people's visit is prolonged until we can be certain that they are recovered. Okay, a follow-up on the context that we have been, or the follow-up of people following the 2 cases last week that came in on Tuesday, that were identified on Tuesday. So there are 3 groups of people. First of all, the 55 who had left managed isolation on a compassionate exemption between the 9th and 16th of June. And they either went to self-isolate under very strict criteria in the community, or they were on day a leave to go and make visits, for example, to hospice or hospital. And as of yesterday, we had one person who hadn't been located. That person was located yesterday afternoon, and testing's been arranged there. The next group we followed up, of course, was anyone who had interaction through the Novotel. There were all the people who were there. They've all been tested. There were staff as well who were working there. And there were then people who had been at the hotel, the Novotel, between the 6th of June and the 13th of June, when the two women from the UK travelled down to Wellington. Yesterday, we had 11 people that were outstanding of that 190. And of those, 5 have now been further contacted and referred for testing. 3 have a community worker visiting this morning, and there are 3 where we're still working to contact those people, and we're using our finding services to ensure that we can make contact with them. And in terms of the staff at the hotel, of the 11 that were outstanding yesterday, there's only 2 that remain outstanding, and the hotel is following up with those. They will be tested as well. Then the next group, which was our really trying to cast the net wide, is to follow up everyone who left managed isolation from other facilities between the 9th and 16th. So as of last night, we had identified there were 2,159 people in that category. I should say that does include the people who had exemptions and the people who were at the Novotel for some of that period. As you will recognise, the dates don't quite match. The Novotel was the 6th to the 13th. So that figure of 2159 is we've got from Healthline, because they're all the people who they were doing call-in checks to check on their welfare 3 times during their visit. Now those calls are in addition to the daily health checks by the nurses. That's more about welfare, planning for when they leave, making sure they've got accommodation and support. All those people, the ones that I haven't talked about already, have, of course, completed their 14 days isolation, which has been and remains the most important part of the border safety. They all received health screening on departure, and testing was offered. So work is ongoing to make contact with all of the people in this group. In terms of getting in contact with them, they get a text, they get a call. There are 4 follow-up calls, and if we don't get a hold of them, then we use our finding services, which includes customs and police, to get an address from their database. And then if necessary, like we did with the person yesterday, we'll send either a health provider around, one of our local health providers, or we can use the police if necessary to locate them. So work is ongoing with that group. And just to reiterate, these are all people who have spent the 14 days in self-isolation, in managed isolation, and we are just following up as a final precaution with them all. All of those people will have received contact, or there will have been attempts to contact them. Sometimes the phone numbers are phone numbers offshore, so they're international cell phones, and the calls don't go through. But if anybody in that group hasn't yet been contacted, then I'm asking them, as I did yesterday, there's a dedicated number with a dedicated Healthline team, 09 302 0408. And as you'll recall, prior to the 9th, when we started to introduce the double testing, everybody had completed 14 days and then gone out into the community, and that remains the mainstay of our efforts to prevent importation of cases into the country. And I guess I'd just like two more comments to finish. New Zealand is one of a very small number of countries that not only includes the 14 days mandatory isolation, managed isolation, but also the double testing before people are allowed to go out into the community. This is, first of all, consistent with international evidence about that 14-day period, and that once people have completed the 14 days, they pose a very low risk to the community. Even if they might still have virus detectable, it does not mean they're infectious. And often the comparison is made, for example, with the jurisdiction of Taiwan, which has got a very good process for people coming in. But I should say that is not a managed isolation process. That is people self-isolating at home with community follow-up, very good, strict follow-up. So we're, as I say, one of very few countries that do that. And finally, a question that has been outstanding for the last few updates, a homeless person who apparently spent some time in managed isolation in Auckland. As far as we can tell, this is cannot be verified and may well be an urban myth. Sorry to disappoint you there. But thank you very much. But if anyone has information on that person, I'd be very happy to take it as well, please.
2,159 people who left managed isolation. How many of them left without being tested?
I still can't tell you that number. And
why not?
This is because the testing was done and no NHI was necessary on the information the hotel has got. So we're busy matching the testing in the laboratory database with the names and dates of birth of the people that we now have from that research.
It was a week ago, though. Isn't that pretty poor that you can't give us that?
Yeah, I wish I could, but what I can say is, of course, that they'd all completed the 14 days. We had started to introduce the testing. We do know that many of them were tested on departure. Many of we have followed up because they were in the Novotel or had been on that compassionate exemption. And we are wanting to follow them all up and do that match across. And yes, I would like to be able to have that number with you, but the matching work is ongoing.
All of those 55.
About the 55 who were granted compassionate leave, were they tested before they were?
Some were tested before they went out and some were not, but we have subsequently followed them up. Now, just in that group, what I can say is yesterday I said there were 4 who hadn't been tested. That was 4 children. There are several others, 3 who weren't tested because of the circumstances, which were medical circumstances. Either they were going to get medical treatment and then it would have been a clinical decision to do it, or in fact they were palliative and going home. And then there are several who, once they their circumstances changed, so they decided to actually leave the country, and so they weren't necessarily tested before they left again.
Do each of those 3,000 odd people, do they pose a risk? I know that you said that the 14 days is kind of the key thing here, but if they're allowed to mingle with other people who potentially have COVID because we didn't identify that through testing in those self-isolation facilities, do each of those 3,000 people pose a risk?
They pose a very, very low risk to the community because A, they've completed the 14 days, and B, they are in managed isolation. And I know there have been a lot of stories about so-called mixing and mingling, which sounds like it's a wedding reception or a cocktail party. That is not the circumstances in these facilities. And you also know that, just to be sure of that, Air Commodore Webb has done an audit of the facility, so we're continuing to strengthen that. And again, we have had cases come in before when all we had was the 14 days, the 35 cases diagnosed since the 9th of April, and we have not seen any cases go out into the community. The 14 days is actually very, very, it's got room at the end over and above when the 99% of people, if they're going to be show the infection, will have done that by day 11 or 12. So there's already room built into that. Yes.
So the 7 of the...
Sorry, just one follow-up question.
Can you explain why there was a period of 37 days before June the 9th when we didn't identify any cases with links to overseas? And I know your point to increase numbers and COVID hotspots, but is it also because you weren't testing enough? So
I don't think it was because we weren't testing enough, because you will recall through that period of level, in particular level 3 and into level 2, there was very wide testing happening around the country. And if there had been any infections leaving those managed isolation facilities, we would have picked them up there, but we did not pick them up. So we're confident that not only was the 14 days being the mainstay, but also that we didn't pick up any infection out in the community. So saying, we're now doing the double testing, and it may well be that in addition to the 35 infections that we did detect during that period because people became symptomatic, there may have been some people who were infected and asymptomatic, but the 14 days served its purpose, and that it will continue to.
We were celebrating zeros when there may have been cases that we weren't identifying.
We were celebrating zeros because we were very confident there was no infection out in our community, whether from people who had come through managed isolation or from people who had been infected through community transmission.
So you said that the 2,000 odd that we've managed isolation since 9th of June offered testing. Wasn't at least stage 12 testing mandatory by that point? Why was it only offer?
Yes, so it is mandatory now, and it's in the new order. And under the old order, there was different. There was interpretation.
The law passed was very clear on the statute books.
Mandatory
testing.
Yes, well, the new order says that.
But the law that was passed by Parliament and the health response made it very clear that testing was mandatory and could be enforced.
So the testing at the border and all the quarantine arrangements sit under a health order that's under the Health Act that went into force on the 9th of April, which is from myself as Director General of Health and as National Medical Officer of Health. In there, it does not mention, it's not specific about testing. It talks about low risk and high risk. And that was the point that I clarified last Tuesday, that people could not be categorised as low risk unless they had also returned a negative test in addition to completing the 14 days.
So these have been since, so I come back to my original question, these have been since June 9th. The people released, you said, were offered testing, but since June 9th, it's been mandatory. Why is it an offer and not enforced?
Look, this is the point I addressed last week, that actually there was clearly the implementation, there was just a breakdown in the communication there. That's what I clarified last week. And so everyone who has left since the 16th will have needed to return a negative test. And that's made clear in the new order, which came into effect yesterday, that that testing at around day 3 and around day 12 is a requirement of managed isolation.
Would you be confident that the breakdown of these people since the 16th then would have definitely been tested if it was a bit unclear up until then? I mean, is there any point at which you can say people are not offered tests there?
Yes, that was what I made clear. As soon as I found out about the 2 cases on the 16th, within a very short period of time, within the hour, a message went out to all the facilities, and I had checked with my chief legal advisor that I could, in my opinion, someone was not deemed to be low risk unless they had returned a negative test, as well as the health check. Some of them were not tested, that's right, and that's why, as an extra precaution, on top of the 14 days, we're doing the follow-up phone call, and if they hadn't been tested, well, we're asking them to be tested.
Do you have a sense of how many of them have not been tested?
Derek, sorry.
Do you have a sense of how many of them have not been tested?
I don't. I'm sorry. It's the teams are working all the time, and the numbers are changing all the time. But I would like to have that number, and that was asked of me. But it's about being able to match with the NHI number, the laboratory data with non-NHI data that is collected at the facilities.
Do you know also if 7 of those 55 weren't tested because they were children or because of medical reasons, do you know how many of those remaining 48 who were granted compassionate leave, how do you know how many of those were not tested?
When they departed the facility, before they departed, I don't. And again, the key point here is some of them it was day leave, and there were very strict requirements, PPE use and so on, and then they're back, so they're being tested. They were subsequently tested in the facility as part of the testing, and likewise others who have gone out in the community have been followed up and tested.
Why is it so hard to find that information? Shouldn't that be quite easy to find?
Look, I wish it was easier, and this is one of the key challenges for the healthcare system, is being able to link up. We do have the NHI. Once we have the NHI, we can link data from a whole range of different sources, and that's a real asset to us. And in this case, the information collected in the hotels for managed isolation purposes didn't include the NHI. Of course, now that we've got the routine testing, we can collect that NHI as soon as that testing starts, as soon as people get that first test, and then we're able to match up the results.
But people will look at that and say, you've got 48 cases there. It's been a week. We've been asking how many have been. It was a prerequisite to be tested before being granted leave on compassionate grounds. So, and people just consider that time period and say, what's going on there?
Some of them indeed were tested. What I can say also is, and you'll have seen the expectations and requirements around people going on compassionate leave. There's a very strict set of obligations and criteria on them to ensure that the community is kept safe. They're going and the reason they're called compassionate grounds is because they're going to either spend time with a loved one or to grieve with their friends and family. And there are very tight expectations around that, which were designed to keep the community safe. Sorry, we'll just actually, I was coming back here.
When were health authorities made aware that a contact had visited the 2 women isolating in the Hutt area?
Yeah, so I've just spoken with the Medical Officer of Health about this. So there was, as I said last week, there was a number of people that came to the house to drop off food, and understandably one of those in the all non-contact lists, so all contactless, that one of them spent some time at some distance talking with the women. Now, this can happen, for example, at our managed isolation facilities. People are able to communicate through the fence with others. There's a distance separating people. The medical officer of health talked about it with the person. There wasn't deemed to be any risk at all, but the person chose to or did self-isolate and was tested. I've just checked with the medical officer of health last Friday, and the test is negative. So
just to be clear with this one, were there rules around dropping off and visiting people when they're on these special exemptions?
Well, yes, there are, and except that these things have to be contactless, of course. So people are dropping food on the front door.
So this wasn't breaking the rules.
No, because there was separation. There was physical distancing there.
And so we've had reports from doctors working in GP clinics that there's been a bit of an upsurge in people requesting COVID testing. Do you think that the testing facilities around New Zealand and the spread of them are adequate right now?
I do think that they are adequate, and what we're talking about with the district health boards today is making sure that we can maintain 24/7 testing capacity. And also there was a discussion this morning, Dr Jeff Lowe from GPNZ talked about the need to maintain the community-based assessment centres, because we may need to surge up capacity. And yes, you're right, off the back of the cases in the last week, there has been, I think, a high level of awareness and people are going for testing. And you'll have seen that the rates of testing have gone up, the numbers of tests have gone up.
Coming back to Derek's question, why is that information not coming through? Are you getting, is there obstruction on that information about compassionate leave and testing on the ground from officials? What is the hold up with this information a week later with a relatively limited number of cases?
So there's no obstruction. I can be really clear about that. I just want to be able to give you the right numbers, and that we've got a team that does NHI matching, so it can get name and date of birth information, and they're busy matching the results we're getting from the lab database with the people who were in the facilities, whether they were granted compassionate exemptions or they were amongst the rest of the balance of people.
Is it being done with urgency? I mean, the National Party leader today, basically say that it's dragged on, it's too long, and people should know the status of these people who are given compassionate.
What is being done with urgency is following up the people, all of the people, starting with the ones who might have presented a slightly higher risk, that is the compassionate leave people, notwithstanding that they all had very strict expectations and protocols around their release from managed isolation. Then the people who might have had some potential contact with the two women who were at the Novotel, and then we stepped out to that wider group. So that's the bit we're focusing on, is making sure we are contacting all those people, recalling that now we're down to people who have all done 14 days in managed self-isolation, but we are following up as an extra cautionary patient. It's a huge priority. The compassionate leave ones, yes. The following them up, absolutely. The question is the making sure they have had a test, and if they're reporting when they're contacted that they hadn't had a test, then they've been referred for testing.
You mentioned in one of your earlier answers to Derek, I think, that some of those people who were granted compassionate leave were tested. So that some of them were. How many were? I
don't know the number, but I do know that some of them were tested. I've been told that.
So you've got a bit of an indication as to how many might have been tested and how many weren't. So why not share?
No, I don't know the number. At the moment, I can say I know some were. But obviously some weren't as well. And part of that was because of the 55, 20, from what I can recall, and his number I do know, and I think I said it yesterday, 24 were going out into self-isolation. The balance were either in transit or stayed in the facility, then their circumstances changed, so they left to go back overseas, or they were just going out on day visits. Can I just come here?
Why haven't you released the unmarked?
Now, I understood it had been, and I followed up with the team yesterday, and if it's not on the website, it will be soon, but definitely not holding that back. It's been a really helpful document, just as we've published all the other reviews done by Aisha Viral and others on the contact tracing.
With those testing numbers, though, can you see why it does go to the heart of public confidence when we don't know how widespread the problem is, and why weren't a group of Ministry of Health staff thrown at this? We know that you're exceptionally busy, but why not see this as a problem and let's just get it sorted?
Yeah, can I just confirm that they don't present a problem out in the community. We are now working through the balance of these people as an extra precaution. They all spent 14 days in managed isolation. I'm very keen to make sure we follow them all up, and I think the public is keen too, and that's why we're progressing that. We have thrown a lot of resource at this and will continue to.
When will you have that
about
number?
the 2 women as well, and the 2 women did end up meeting people, and they did turn out to be
Yeah.
COVID positive. So don't
Yes.
55 people represent 55 potential cases of COVID.
The 55 have all been followed, so they have all been followed up. That's the 55 exemptions I'm talking about. So we've worked through from the highest, potentially highest risk, although the risk was extremely low because of the protocols in place, then to the Novotel, then to the broader group. So the 55 have all been followed
So
up.
why then can't you tell us how many of those 55 have been tested and how many haven't?
I just don't have the number here
Why
with
not
me. I'm
just
sorry.
ask them?
So I haven't personally asked them, but
Your
we will.
officials.
Yeah, that's right. Yes.
But have you followed-
Yeah,
you've
I
spoken to
think,
all of them,
again-
the ministry's spoken to all of them.
Yeah.
Why not just ask them if they were tested or not?
Okay. Let me just I'll come back to you on that. I just don't have that with me.
When
Okay,
will
I'm
we
sorry.
get these numbers?
Yep. Sorry.
Do you know when we'll get these numbers?
I am keen to get them as soon as possible, and I want to share them with you when I'm confident in the numbers.
So why do you think that they weren't, because he said all but one have been tested of those 55, is that correct?
Actually, all but one had been followed up yesterday. They had contact had been made by yesterday, and that person was found yesterday afternoon and taken for testing. The 7 that hadn't been tested that I know about, and I wanted to update you on that. Yesterday I said there were 4, that was the children, but there are 3 others who, because of the circumstances, didn't require a test for medical reasons.
They've all been contacted,
Yeah.
and it is important
Yeah.
to know,
Yeah.
going back to what Tova asked,
Yeah.
why not ask them when they're contacted, whether they were tested before they left?
Yes, I
And
agree.
I understand
And
you're
yeah,
trying to, like,
yeah.
The health response is most important and you need to
Sure.
follow and test them, but that number is critical to understanding the depth of failure in the protocols that were meant to be followed.
Yeah, well, what was followed was the requirements around their self-isolation or their visiting protocols. So I will get you that number, and I'm sorry I haven't got it. As I've said, I would like to have it as well. There's a question over here.
The NHI number collected for that, 2-month period from April 9 until very recently, was that an oversight?
I don't think it was an oversight. It was just the nature of the information collected, and there's good information on people because they've come through the border. So there is contact information and there is address information, noting that for some people, actually, they hadn't been in New Zealand for quite some time, so may not have had a permanent address, and may not have had an NHI number. But clearly that's something now we will be able to have the NHI number so we can match to other records immediately.
For the new case today that ended up accidentally in quarantine instead of managed isolation, how did that happen? And can you assure us that it hasn't happened the other way, where someone who's supposed to go to quarantine because they were symptomatic ended up in medicine?
Yeah, now I don't know exactly how it happened. I just got that information late morning. But sometimes the jet park facility is used for managed isolation if the other facilities are full anyway. But evidently, I'm told, all I have is that there was a mix-up at the airport around the queues. They ended up in the jet park. So that's where they would have been transferred upon diagnosis anyway.
Talking to people at the Jet Park Hotel, they say it was only when it kind of hit the news media, the fact that those 2 women being released without being tested, that there was suddenly this hustle to test. Is that what happened?
Look, I think there was testing being rolled out. That was started with the day 12 people so that we could get as many people as possible before they left managed isolation. Just bringing you back, this is in addition to the 14 days. Yes, it has absolutely sharpened our focus, and I said that last week, and that's why as soon as I found out on the 16th, I asked that no one leave managed isolation unless they've had the test, and the result is negative.
For those 37 days when no cases were identified with links to overseas travel, there were about 7,700 people that arrived in that country, in the country over that time. So to not identify any cases until after the bundle last Tuesday, and then suddenly have nearly a dozen cases in New Zealand, it suggests that you weren't testing enough.
The mainstay, again, since the April the 9th, has been the 14 days managed isolation, which is international practice. We have added in the testing from which we introduced from the 9th. We couldn't test everybody on the 9th, but that is now in place from the 16th. Everybody has around day 3 and around day 12. And I talked earlier in the week about the reasons why we are now seeing the cases. First of all, yes, we are testing. That doesn't mean there was a risk previously. But secondly, the pandemic is accelerating overseas, and we have got people coming back from countries like India and Pakistan, and we've seen the UK and today western seaboard of the US, where they do have a lot of this infection out there. And so hence I think it's helpful we're identifying the cases, because then we can make sure we're really keeping the border safe.
What number? 7,700 were coming from COVID hotspots as well. So are you expecting people to believe that 7,700 people came into the country over 37 days and none of them had COVID-19?
Well, all the ones who developed symptoms, we did identify through testing, and we found 35. There may have been others who were asymptomatic, and that's why they had the 14 days managed isolation, and why we're confident they didn't present a risk to the community, because we did not detect any infection out in the community, and we're now up over 20,000 people who have been through our managed isolation facilities.
What testing rates? You talked about 4,300 today. What's the minimum number we need to do each day to be able to give ourselves effective data to know it hasn't spread?
Well, we know it's not out in the community. However, we have been testing right through, even through alert level 2 and 1, when we were confident there wasn't any community transmission, and will continue to test people with symptoms out in the community. And we've seen an increase in people presenting for testing, partly because we are going into winter, so more people have respiratory symptoms, but also I think the awareness over the last week. Then we will be doing the testing of everybody twice in managed isolation facilities, and we are seeing the number of people in those facilities grow. And we will be doing surveillance testing of people working in those facilities and at the border. So there will be thousands of tests being done every day, and we can do up to 12,000 or just over 12,000 if necessary.
Is there a minimum, though, you've told your officials we have to get over 2,000 a day or over 3,000 a day?
No, I haven't set a minimum. I know we will get more than that because of the testing in the facilities. But what we want to do is, in a sense, the testing out in the community is like supercharged sentinel testing. In a regular flu season, we do around 270 swabs a week across the country in 90 practices. The first 3 people that come in the door with respiratory symptoms each week get a swab in those 90 practices to see how much influenza is out there and what type of influenza. We're now going to be doing thousands a day, which I would call, just really, really extensive sentinel testing in the community to make sure that if there is any virus out there, we are picking it up.
Do you have enough capacity and funding for all of this testing?
Yes.
Yes. Ever since last Tuesday, when you got the testing working in these facilities and you kicked it into higher gear, you've been finding cases. Was it a mistake not to be testing before the 16th, even and before the 9th, so that, in response to questions like Tola's, you're not kind of guessing, but you would have actually know what the situation looked like?
I don't think it was a mistake, and I think the question's been asked for 2 reasons. First of all, the 14 days is the mainstay and remains the mainstay, as I've said. Secondly, remember that one of the reasons we brought it in was to because we were moving to alert level 1 with much more travel of people around and interaction with people. So prior to that, under the previous alert levels, there were still constraints on numbers of people and events and so on. So that, coupled with the 14 days, I think provided, and we have evidence that provided us with a high level of assurance that there wasn't infections getting out into the community from managed isolation, because we weren't detecting any out there in the community.
And there was talk about a month and a half ago about a system of sewage surveillance. Has there been any news on that, or are you aware of any work with MOH on that?
ESR has developed the capacity to do this, and in fact they collected samples through the period when we had known infection in the community through March and April, and have been able to detect the virus in sewage samples. So they now have the technology to be able to use that as part of our ongoing surveillance, and that is part of our surveillance plan from here.
Is it being used?
I don't know if it's been used right now, but we'll come back to you on just where they are at, what the intentions are with the next stages in that.
Will you be able to tell us if COVID-19 was in the country earlier than that first identified case? Will we do?
Yes, it could. It could, of course, where this has been used elsewhere, there are much higher rates of infection. But what they have shown is they were able to detect the virus when we had those, even then, still low rates of infection in the community. And then they will be ongoing testing as part of our surveillance to just see if there is any in wastewater. So that will be part of the overall surveillance.
Do you think that there's a weak link in our protocols in terms of the lack of enforced self-isolation for flight attendants coming back into the country?
Yeah, that's something we're looking at very tightly. The area we were most concerned about was the western seaboard of the USA, just because of the arrangements there. So we've worked with Air New Zealand to introduce that in all those aircrew have to stand down for 48 hours and be tested and return a negative test. We've been talking actively with them over the last 48 hours around Australia, because what's clear is that people are coming from high-risk areas converging in Australia in transit and then coming across. And we've had several cases now on those flights. The protocols used on those flights by the staff are the same as on any international flight. So I'm confident about that, but we're looking at what else we may need to add, and active discussion, and expecting to confirm some further arrangements with them. One which is already getting underway is the provision of masks to all passengers on those flights.
And
now,
that could look like an enforced managed self-isolation period of 14 days for fuel crews.
no, I don't think it will look like that, but it could look like, and one of the measures could be to make sure that those crew are solely on international routes, not also flying domestic routes, because they're the same A320s are used. It could look like similar to what we're doing with the LA staff, but we'll work with them on that. The main thing here is we're trying to reduce the risk to the crew and, of course, to the wider community.
Are you looking to bring those masks, sorry, to clarify, passengers on flights, those masks, are you looking to make that mandatory?
What we're looking to do is, and the advice is that that's strongly recommended. And so I talked to the CEO of Air New Zealand on Friday. The minister's been talking to Air New Zealand again today, and the intention is that the masks will be handed out to all passengers once they're on the flight, and they'll be shown how to wear them. So there may be the odd person who can't wear one for a medical reason, but I think people will understand that that's part of the protocol and use them.
Do you consider our isolation, the strict isolation, that it's strict enough? Like in Australia, for example, if you're in isolation 14 days, you're only allowed 15 minutes outside of your room every week. Should ours be tighter?
Well, we're looking at that. It appears to have served us well to date, but of course we're looking at whether we might strengthen it. For example, at least for that first period until people have returned that initial test as negative. But we're looking at all these things. We're really, really focused on making sure it's working as it should. Perhaps the last couple of questions.
Currently they're allowed to leave every day for some fresh air, is that correct?
That's my understanding, yes. They can go outside and into the area outside the facility and do some exercise, but not out onto the streets.
Can I just rephrase an earlier question? That you say you tried to find that number on the compassionate grounds who haven't been tested, and you want to know that.
Yeah.
Do you find the fact that you haven't been told, we don't know, do you think that is acceptable?
Look,
and if not, what needs to change? Should it just be like a simple database?
Yeah, I agree, and it's what I've got people working on at the moment on, including with the all of government team. So we've got a single database that covers end to end, including the health aspects of that managed isolation process, as well as the non-health aspects. Yes, I think we need to get that in place, and I know there's a team working on that. I would really like to have that data and to be able to provide you with the same certainty every day as right from the start of being able to provide the case numbers and the cluster numbers and all those sorts of things. So we're wanting to nail that very quickly. I can't say. I'm sorry, but I will find that out. Okay.
Hi, is the Ministry of Health advising Air New Zealand on any, I guess, lifestyle options for flight attendants that come back? Like, are you advising them maybe not to go home the weekend after they return from an international flight?
Not at the moment, but all these things are obviously in discussion. The key thing is, and this has again served us well right from the start of the outbreak. You'll remember early on, in fact, the protocols being used by flight staff now are the same as the ones we developed and agreed for that very first evacuation flight out of Wuhan. So the same use of masks and/or gloves and/or hand sanitizer and infection prevention control cleaning procedures are now the same on any international flight as they were with that original Wuhan flight.
So as it stands right now, if I was a flight attendant, I could fly from the US back to pick up someone from Australia who'd been in the US, fly back to New Zealand on Friday, and then go out clubbing with my friends on Saturday.
Yes, potentially. However, again, with the caveat that there are very clear protocols in place, because of course Air New Zealand want to protect their crew as well. And so those protocols, which have been in place since that February evacuation flight, are the ones that are still being used now. On a question?
Has there been any thought towards using these rapid point-of-care tests either on that day one at the border or in other scenarios? Yes, definitely watching that. And I just read last week a study done in Australia about the point-of-care testing, and also there's the serology testing as well. Just still not reliable enough. And whilst it could play a part in the overall sort of checking people, both at exit and entry, but we don't think it's reliable enough now. I should say the other thing we are doing is looking at the protocols and processes in place where people are getting our boarding flights at different ports to make sure we've got a high level of confidence that there's appropriate symptom checking and or temperature checking before people get on flights to New Zealand.
Do you think it's good enough that you don't have, that people, you should have these figures to hand, the testing figures, that you don't have them? Is it your officials let you down?
No, they haven't let me down. As I said, I would like to have those numbers. What I can say, and what we're absolutely focused on, and that's why I'm here today, is we have worked systematically through where there may have been any risk and spread the net very wide to make sure we contact, first of all, the managed isolation exemptions, compassion exemptions, then anyone who was in the facility or associated with it, that's an Novotel, and then we've gone even wider just to be sure. But this is an extra precautionary measure, remembering that the latter group, everyone had done the 14 days managed isolation. I'm as keen as anybody to ensure that New Zealanders are kept safe and that they feel safe. And part of that will be ensuring that we can assure them about the numbers. So we will get them as soon as possible.
Do you accept that undermines confidence in yourself and the ministry?
I think what would undermine confidence is if I wasn't fronting, if I wasn't saying I'm responsible for sorting it out, and that we weren't following up these people and doing everything we can to make sure New Zealanders are kept safe. That's clearly what we are doing, and I'll stand by that. Thank you.
Thank you.